Hi, this is Jenny Steiner, nurse practitioner at Advanced Anti-Aging and Weight Loss. This is Straight Talk, and I am here with Evelyn.
Hi, I'm Evelyn Kite, the client liaison here at Advanced Anti-Aging and Weight Loss.
Evelyn and I decided to talk about something. Since last week we spoke about the bioidentical hormone replacement, and it's usually for when women complain about menopausal symptoms. And menopausal symptoms differ from woman to woman, but particularly they talk about vaginal dryness or lack of libido, and then sometimes hot flashes and those kinds of things. So today we're talking about the Viveve laser for vaginal rejuvenation.
Right.
And so it's FDA approved for vaginal rejuvenation for tightening of the skin. It also helps with vaginal dryness and also helps with sensation.
Yes.
So all those kind of go together when you combine that with hormones. For women, it is a life changer.
It's a life changer. And it also helps with stress urinary incontinence. So a lot of women, as we age, we have children, we want to, kind of run, we want to play with our kids. And some people kind of like cough and pee, sneeze and pee, run and pee. Sometimes some women actually have issues with that more than others. And it is a one-time treatment. So
well, a lot of women have that, and it prevents them from doing a lot of things in their daily lives. And with vaginal births, it's very common. And not a lot of people talk about it because typically the only other treatments for it are surgery, which doesn't have very good outcomes at all. And there's a lot of risk with it for complications after the surgery, and may or may not be very effective. Also, there's physical therapy that you can do, which takes a very long period of time, and it's kind of, I guess embarrassing.
It's very embarrassing if you think about what they have to do for that.
They have to train those muscles down there several times a week for several weeks. And that's not, number one, it doesn't fit into your schedule. Who can do that in the hours that you have to? And so to go in and get a treatment with this makes it super simple to do. A lot of people don't understand that there is, as you age, it's not just your face.
Nope. Everything kind of falls.
Nothing is going to not age.
No.
It's unfortunate.
It's gravity. It's just going to pull.
Well, it's gravity. It's just the skin breakdown. We don't make things like we used to.
Not there.
And all of us want to stay perky and
from head to toe.
Yes, from head to toe. So this machine gets that. And the thing I like about it is there's no pain with it.
None whatsoever. None.
And it's one treatment.
It's a one-time treatment. FDA approved, so.
And it's the only laser for this that is a one-time treatment. All the other ones you have to do at least 3 times, and they take a long period of time.
Right.
For the vaginal rejuvenation, for the dryness or the sexual pleasure, it's 30 minutes, and it doesn't hurt at all.
Right.
And so I'm doing the procedure, and so it's completely comfortable, and it's just really girl talk for 30 minutes.
Yeah, and that's exactly what some patients have said. They come to me and they talk about, I really want to be able to get on the treadmill. I want to be able to not have to wear a pad, or feminine issues. They're like the smell. They want those things not to be there. And then they're like, okay, so what is this like? I'm a little uncomfortable. I don't like to even get a pap smear. And I let them know. I've talked to the patients once you finish with them, and they come out of there laughing. They're just, once you start the procedure, you don't even realize what's going on. They're comfortable. You're laughing. It's relaxing. We make it as comfortable as we can, and as relaxing as you can.
Yeah, because you don't feel it.
No.
So it's basically people are on their phone, and playing on their phone, or, we're having a conversation about, whatever. And it's really a comfortable experience because it's just something I do all the time. So it's really not a big deal to me. So I've even done it on my sister, which you would think would be awkward. But
I don't know that I want to do it myself.
I'll do it on anybody. I don't care.
Right.
Yeah. If I can help someone, I'll certainly do it. But it's a groundbreaking treatment for women.
And it's helped so many women. Just to say, like, the last patient I had, she said that, she could not even, like, stand up from being on the floor without going on herself. And that's, 3 weeks later, she's calling and she's super excited. She's like, oh my God, I actually got on the treadmill and I ran for 2 miles and I did not have any issues at all whatsoever.
And people talk about going to trampoline parks with their children or just doing an exercise class or an aerobics class. That's something that they are or even like amusement park rides. You wouldn't think about that when you just suddenly drop or something like that. I mean, you can leak urine.
And this isn't for somebody, I mean, this is for any age. I had as young as a 25-year-old come in, and she had already had 2 children, and she's like, I have this issue. She wants to have, she doesn't want to have any more children, and knows that this isn't something that's normal, but she thought it's something because her mom and her talked about it. This is something that old women get. Well, it's not.
No.
You know, it's caused, you've had a lot of trauma down there. So,
well, even if you don't have trauma, you might have weaker pelvic muscles, and that's just genetically how you are. And this is something for that too. So it's not just from vaginal births or trauma. It's really just genetically you can have weak muscles because it's going to strengthen those muscles. And so it's just a really good thing for women to do that will change their life and improve their quality of life. And if they're menopausal and then you combine the hormones with it, amazing.
And we have a great special.
And for Valentine's Day.
I forgot we had the hormone.
So show this video to your husband.
Yes.
Because he will probably surprise you with a gift. Yes, wouldn't that be wonderful?
Have him call me.
Yeah, that'd be awesome. So if you are interested in this procedure, just want to talk about it and see if you're a good candidate for it, I suggest you come in, see Evelyn, and introduce yourself. She'll go over your health history and the procedure itself in more in detail, and see if that's something that you want to do. We do have it on special this month,
right?
We do.
Yes.
Yeah. Yes. So it's a really good time to take advantage of it. You don't necessarily have to do it this month if you've got vacations or a lot of busy time. You can always just take advantage of the special and then schedule it at a later date. We're doing straight talk every week. So if there's a topic that you want us to talk about, we'll be more than happy to do that. Just message us, on the Facebook, or just private message us as well. And we'll try to get to your topics for you and answer any questions you have. We're here for you, and we really want to help you make good decisions about your health care and your quality of life. And so anything that you guys think would be a benefit to you to learn more about, we're here for you, and we'll be happy to talk about it next time. So,
and also don't forget, next Wednesday we have our event for the Profound and the Ultra Shape. So love your look. It's from 4 to 6. Dr. Center actually will be doing a presentation to talk about those services and all other services that we have here. So just let us know if you RSVP so we know how many people are going to be here.
Yeah, and I can't wait to meet you all then. So make sure you bring your questions with you, and I can't wait to meet you. It'll be a good time. So we'll see you next week.
Bye.